Yields back. Chair now recognizes Mr. Lynch from Massachusetts.
Thank you, Mr. Chairman. Dr. Califf, welcome. Thank you for your good work. Dr. Califf, in March of 2024, the FDA issued a proposed rule regarding electrical stimulation devices that are intended to reduce or stop self-injurious or aggressive behavior in some patients. The proposed rule, if finalized, would remove VSDs, these electric stimulation devices, from the market, and the devices will no longer be considered legally marketed. I've tried to read as much as I can on these. As an attorney, I try to refrain from making medical decisions on my own, especially for my constituents. I do know that the Geneva Convention regards these devices as torture. But I also have a group of families in my district who are, they have children and loved ones who are undergoing these treatments, and they claim that those treatments help. Now, as a result of this rule, these treatments will go away. And my constituents have asked me to ask you and the FDA to meet with them to talk about the consequences of the FDA's rule. And so as a member of Congress, on behalf of my constituents, I'm asking you and or your staff to provide an opportunity for those families to meet with you and to discuss their concerns.
Well, thank you for bringing this up. I know it's part of your duty to do so. This is a very tough issue, and I have worked in psychiatric wards during my career, and I think most people can't appreciate the anguish of families who have loved ones who are in a situation that might call for this or other serious mental health problems. But anyone who's been through it, I think, has a special feeling about it. As I think you know, there is a proposed rule that we've now put out there. There's a docket, and we do encourage everyone to submit their comments and views to that docket. I will definitely take this back to our staff. I know that our staff has met with these families before, but this has been going on for a while, so we'll go back and reconsider.
It has, and it's heartbreaking. Let me ask you, so shifting to something completely different, last year the FDA made nearly 200 additions to its public list of AI and machine learning enabled medical devices currently marketed in the United States, and there's been some wonderful success. Dana-Farber Cancer Center is near and dear to my heart. Mass General, Brigham, their cancer center as well. Wonderful, wonderful progress in diagnosing breast cancer from mammograms. Clearly, there are enormous potential benefits here. But there's also some concern around privacy and also the lack of explainability of some of these algorithms that are being used on the diagnosis or the predictive end. What are we doing to mitigate the negative aspects of the use of AI? And I know it's coming at us hot and heavy in so many areas, but I'd like to hear what the FDA is doing about guarding against the dangers that might be present by this widespread adoption of AI.
Thanks for the question. I'll have to contain myself here because you may know that I worked at Alphabet or Google during the 5 years between my two FDA stints and very heavily into this, and I think it's going to be a huge benefit, but also with a huge risk on the other side if it's not regulated. Also, we have many mutual friends. I'll be at Mass General next week as visiting professor and learning from the people in the Harvard system who know a lot about this stuff. Well, this is one of the topics. The thing I would emphasize is that I don't think it's explainability that's really the issue. And I think an easy way to think about this, think about yourself before you had a map in your car that you could talk to. When you used to drive the car and you get in an argument about which way to go, and then you'd have to pull out the map and look at it. Well, now you just talk to your car. And what's going on with the car is AI continuously in real time, taking into account everything that's happening on the roads, the template of what's there, and your personal preferences that it learns as you go along. And I think if AI works, we'll take it for granted because there are many things we do in medicine. If you ask me, how does aspirin work? We know a lot about aspirin, but exactly how it works for each disease, we're not so sure. But we know it does work for particular things. So what we're really focused on is creating a community in our health systems and the industry that, like I've already said, we're referees. We depend, the first line is self-regulation by the industries. And what's really important here, I think, where AI is going, generative AI, it learns as it goes. The more information it has, either the better it gets or the worse it gets. You don't know which one. And if you just put it in place and don't tend to it and monitor it, it can go wrong in really bad ways. I saw that at Alphabet. It was something we were really worried about. And so we've got to reformat our health system so that as time goes on, you're constantly looking at what the algorithm is doing. Are its predictions accurate? That's really the key thing that we have to do. And right now, we are not configured to do that. So we're working very much with a community of health systems and the industry to come up with a scheme of what's called assurance labs. And this would be, you sell your AI thing to somebody, it goes out there, there's going to be a monitoring that says it's either working or it's not in practice. And it also looks for this bias that we're all concerned about, that if you put the wrong information in, you end up with a prediction which is preferential to one type of person compared to another. That's got to be looked at.
Yeah.
So I'll stop there. I know
Yeah.
I can go on a while on this.
Mr. Chairman, thank you for your, well, thank you for your answer, Doctor. Mr. Chairman, thanks for your indulgence. I yield back.